thank you everyone for joining us out there today. Today we are so honored to have General Evon with us, especially at a time where we know the women and men of the Connecticut National Guard are working so hard day in, day out to respond to the current global health crisis we're in with coronavirus. So welcome, General Evon.
Thank you very much. Just coming out of a unified command meeting with our stakeholders, and we are practicing social distancing, but I'm going to lose the mask for now. Thank you for this great opportunity. So to Megan and Amanda, I appreciate it. And real quick, if I can just open up with really our condolences go out to, the victims, the families of the victims. Think about people are dying and without their families with them. So our hearts, our thoughts and prayers go out to them. And we take this very seriously. So with that, we can get started.
Well, we're so thankful for you and all that you do. And the Connecticut National Guard has been a great partner side by side with the World Affairs Council. And the work that you're doing is so critical. Can we start by just getting a briefing on what the women and men of the Connecticut National Guard are doing right now?
Yeah, absolutely. So let me remind everyone, the National Guard has two missions, unlike our active duty counterparts. So we have a federal mission, that's the go to war mission when the president calls, and we have a state mission, that's our mission when the governor calls. And we are full on board with that support to DPH, Department of Public Health, is the lead agency for this response, and we are in support of them. Our three priorities really are the health and safety of our citizens and also our service members. The second is ensuring that we're mission ready. So in this case, when the governor calls, we have the bodies and the manpower, and our team is ready to react to whatever the problem set is. And third is that we support both state and federal partners. With that said, our three lines of efforts, we call them. The first is building medical surge capacity. So we're trying to give hospitals a relief valve. So we've built numerous hospitals. I think we've got 5 surge capacity hospitals across the state. We've got operations and step down facilities set up at Southern Connecticut State University, Western and Yukon Health in Farmington. We mobilized 4 mobile field hospitals. So this is an item that basically it's a tent, a hospital tent, was purchased in 2006 by the Department of Public Health after the anthrax scare. Specifically, it's called the Ali Lundgren Mobile Field Hospital. So success story there is that we, a year ago, started training the Governor's Guard. So it's a whole of military department response. So the National Guard, the Army Guard, the Air Guard, and also the state militia. And the Governor's Foot and Horse Guard have been very, very proactive. And we've been fortunately, we just got lucky, right? A year ago, we actually started working with public health, and their mission, as I tried to have the vision to get the militia better engaged and give them justification for their purpose. We're often asked by legislators, why does the state need horse guard and foot guard? Well, here's why. They just were able to set up those 4 mobile field hospitals. The other thing we're doing is logistics planning. So we established regional points of distribution. So we have Air Guard and Army Guard actually distributing PPE around the state. The state has 5 emergency management regions. So that we had each day this week, we had a region that we delivered to. We are one of our units has taken over full bore warehouse operations. So working with other state agencies, we are inventorying, we are setting up deliveries, and we are moving product in a warehouse in New Britain, again, with one of our stakeholders. Yesterday, we delivered, I think, 100 ventilators to area hospitals. So from a logistics support mechanism, we've really been doing that. I've got to tell you, we're real lucky that we have great citizen soldiers. So what I mean by that is I've got a scientist who works for Pfizer. He's furloughed, and he is modeling. He's helping the Department of Public Health, modeling everything that you see. So I think today's numbers were somewhere in front of me here, but we've got over 971 deaths, 16,000 confirmed positive COVID patients, and over 53,000 tested. So our guardsmen are helping assist in that effort, and we're lucky. I've got a great logistics planning group. I've got another major who ran logistics in Iraq, and he is now augmenting and supplementing the Department of Public Health in those efforts as well.
So just to follow up on a few of the things that you said, how is the state doing with PPE? Are we seeing a lot of shortages? How are we getting new equipment in?
So everybody's asking for PPE around the world, around the nation at this point. Yeah, we are working with the governor's leadership. He's got a team set up. So we've got a donation warehouse, and we've got our standard warehouse. So the national stockpile, we continue to request, and we receive that. So there are multiple levels. We have corrections officers or workers or prisoners that are making masks. I learned of a pilot this morning that the corrections inmates are actually going to be making a small mask for children so that we can actually eventually maybe issue to daycare facilities as we continue to grow and go through this, 15 or 12 to 15 months down the road.
In those field hospitals that you set up, can you talk about a little bit about how they're going to be utilized, or the purpose for the field hospitals?
Absolutely. So I think we're calling them recovery centers. So basically, it's a step-down facility, non-acute. If you're not ready to go home, let's say, so you're not ready to truly be discharged from the hospital, but we can relieve the stress of the hospital bed, you'll be moved into a facility like that. And so we've provided the space for the hospital, some of the stuff, PPE and systems that go inside. And really, that's a success story overall with when we compare ourselves to the rest of the nation. Early on, again, with the governor and lieutenant governor's leadership, we partnered with the CEOs from the major hospitals. And quite honestly, that's helped us immensely, because with that, it eliminates a lot of the red tape. So Hartford Hospital, Nuance, Yale, all partnering with those any and all surge capacities that we've built.
Fantastic. So we know that the National Guard trains throughout the year. We also know that, over the last 20 years or so, a lot of our National Guard has been deployed to overseas bases. So how have those deployments and that training prepared our National Guard for the situation that we're in today?
Absolutely. So this is what we do. So we had an infantry unit in the previous, since 9/11, has deployed to Afghanistan twice. Those are the soldiers that you see setting up many of these surge capacity hospitals, whether it was at Southern or Western. We've had our Air Guard, our Air Wing. They have airfield operators who are operating forklifts, material handling equipment. So it's truly a whole of military, whole of agency effort as we get after this. So in theory, they're doing the real world go to war mission just here at state. This is what we train for. This is what we exercise for, as part of the state response plan, as part of the all hazards plan, we call it. And I'll tell you, our soldiers and airmen are doing great work every day on behalf of the citizens of the state of Connecticut.
So can you talk a little bit about how, or if you're coordinating with your counterparts in the region, New York, New Jersey, Massachusetts, how are you sharing information or working together?
Yeah, absolutely. So at this point, I'm probably on the phone daily with our regional counterparts. We're sharing some assets with Rhode Island. I talked to Massachusetts as well, at least twice yesterday. We have national level calls with the National Guard Bureau. Typically it's a VTC Monday, Wednesday, and Fridays. And I'll tell you, early on, we had great intel from states like Washington and Nebraska. So Washington, where the first cases occurred, we were at a conference in DC early on, and my counterpart from Washington said, hey, you guys got to start paying attention to this. And I can tell you, Nebraska, they hosted some of the first guests from the cruise ships. So, daily updates from them at a national level that I was able to monitor and bring some of that intelligence to the state as we tried to develop our plans as well.
Fantastic. And we also know that you work with international partners. In particular, I know you have a great partnership with your counterparts in Uruguay. Can you talk to me about how that partnership is existing now?
So absolutely. So I think this year we celebrate 20 years with the state partnership program. So 20 years with Uruguay. Most states have one or two different countries that they engage with, either on a mill-to-mill engagement or even emergency management levels, even some with commerce as well. So what we learned from Uruguay, we've actually traded best practices and lessons learned. So I think it was early last week, we were on a VTC with them and some members of our staff, and we talked to them about predictive modeling. We were able to use those same folks I talked about, our med planners, to run some of their numbers and actually bring some granularity to their numbers and what they were tracking and what they shared with us early on, because they were about 2 weeks, I believe, 16 days behind us with their response. Quite honestly, they were talking to us about spring break and kids and not paying attention to some of the early social distancing mechanisms that we put into place.
So just want to remind those that are listening in the audience that if you want to ask a question, please use that Q&A function that is at the bottom of your screen. And that if you want to interact with your fellow audience members, please use the chat function. So a question from the audience is, does the Connecticut National Guard have the capability to assist with testing? Are you helping with that?
Yeah, so actually you'll see on today's news, so a great question, thank you for that. Today down in New Haven, we're assisting with the CVS rapid testing site. So we have soldiers and airmen there who worked hard along with many of our other state agencies, emergency management, the state police, Department of Transportation, and that is up and functional today. That site will run 24/7, 7 days a week. And we're helping with traffic control, some of the admin tasks, but that's another huge resource as we get after the testing piece of this problem set.
So another question from the audience: how are you keeping the members of the Connecticut National Guard safe?
So when you come into, you report in for duty every day, and you may be able to see this little white tag on my uniform here. So you'll see big signs when you walk into our armories. You'll initially go into a screening process where they will ask you a series of questions and take your temperature, and then you'll get your I've been screened for the day piece of sticker. But we take it pretty seriously. So social distancing, we're all wearing masks like you saw earlier, and we're keeping, we've also established a coop site actually. So what I mean is an alternate site. So some of our workers are on different shifts, again, all to increase that social distancing.
So we know we also have members of the Connecticut National Guard that are currently deployed around the world. How are they and how are they staying safe?
So we currently have about 200 deployed all over the world. One is an aviation unit, so a Chinook unit. They're due back in July. We have daily, at least weekly comms. I get an update with them. And we also have some military police soldiers at Guantanamo Bay. They're doing fine. We're tracking them. We're keeping an eye on their families. You know, we're very lucky. We had some community stakeholders. The one that comes to mind is Munson's Chocolates. So typically during the Easter season, we'd have a big gathering breakfast with the Easter Bunny for all the family members of those soldiers and airmen who are deployed. Couldn't do that because of social distancing rules, but we were able to do a drive-through, pick up your candy, greet the Easter Bunny type of thing. So we're very lucky to have many community stakeholders that are watching out and assisting us.
Fantastic. Some great questions coming in from the audience. Again, if you want to ask a question, please use that Q&A function. So thank you so much to you and your colleagues for keeping us safe. Is the Connecticut National Guard helping at all with food distribution? So
not at this point. Amazingly, and great effort to all of our first selectmen, our mayors, our towns, the schools under the SNAP program. They're holding their own. And they're, I forget the thousands, hundreds of thousands of meals that they've actually distributed right now. But at this point, we are not in food distribution business.
So how could someone help you in your mission? How are everyday citizens support the work of the Connecticut National Guard?
So again, this is what we do. We're always ready, always there is kind of our logo. We are Connecticut's home team. We take that very seriously. As you know, we get pretty passionate about that. I'm often asked, what keeps you up at night? And my answer really is, let me tell you why I sleep at night. And that's because I have great soldiers and airmen who are willing to raise their right hand and become part of something greater than themselves, right? Selfless service. They're willing to make the ultimate sacrifice, and they are performing superbly. Couldn't be prouder.
We are so proud of everything that you do. And like I said, throughout the year, we get the opportunity to work with you and we know exactly what you're talking about. So another question. So what is the role of any medically trained National Guard members today? So I know you have amongst your National Guard trained doctors, trained medical professionals.
So another success story. Early on, we asked the federal government through what they call the mission assignment, but we asked for a urban augmentation medical task force. They are currently operating at Stanford Hospital. So it's about an 85-person U.S. Army Reserve Force, augmented by about 9 National Guardsmen. We've got a physician assistant, 2 nurses, and about 6 EMTs down there. They are today seeing patients. As a matter of fact, as of last night, they had 12 patients in their step-down low acuity facility, and another 17 that are basically medium acuity. And really, that's a success story because it was an old wing of the Stanford Hospital. That unit I talked about earlier from the infantry from Afghanistan, they were able to actually clean and I'm calling it unmothball the hospital that was kind of packed up, maybe targeted for destruction, renovation, future plans. But we were able to go in there 2 weeks ago now, clean it up, bring in some beds, and that location right now is up and running in what really is the hot zone of Fairfield County.
That's true. So another question from the audience: with so much misinformation surrounding COVID-19 and coronavirus, what are the most important facts that everyone should know about our COVID response, and how can you help clarify that?
Yeah, so number one is wash your hands, right? Abide by all the social distancing rules that are in place. We're pretty lucky that we have a boss. The governor was very proactive in taking, implementing serious social distancing mechanisms. So, and the other thing was that, quite honestly, that we want to make sure we're always, stay home, stay safe. That's our byline. But we want to make sure that we're following all of those rules, taking this seriously, and we'll all get through this together.
So thank you again. What role will the National Guard play when we eventually move to reopening the economy and we transition, through the next phases?
So we call that future operations and recovery. So we've got a team that's looking at recovery operations. So think about all these facilities that we stood up, how we're going to have to tear them down. Some of this will be hazardous waste that we'll have to get rid of. So I've got a whole cell that's getting pretty aggressive, working with our state partners at their direction and taking a look at what that's going to look like. We always are looking for men and women to join our great organization. So we're always looking to fill our ranks. I could tell you our members have free tuition, 100% free tuition at any college and university in Connecticut. TRICARE insurance is a benefit to all our members, and we are always looking for people to fill our ranks.
So I'll let you get a few plugs in here. How, as we're so inspired and so proud of the work that the Connecticut National Guard is doing, if someone is interested in wants to become a member of the Connecticut National Guard, how would they go?
So again, I have an Army and Air Guard, so I got to give both of them equal love. So on the Army side, it's www.nationalguard.com/CT for Connecticut. And on the Air Guard side, it's www.goang.com/Connecticut. And again, we're doing our state role, which is what we train and plan for. This is what's really unique to the Guard, the National Guard writ large, that we have both that state and federal mission that I talked about earlier. And I can tell you that we have doctors and nurses, we have infantrymen, engineers, firefighters, C-130 pilots, helicopter pilots, navigators, cyber warriors, a big capacity that we're trying to fill that role, especially with the elections that may soon be still on. I believe we're still going to vote for a president at some point. So cybersecurity is a huge role we're looking at developing. So if you're interested, I tell you, I carry around this poker chip. And I'm not sure you can see it on the front. It has
I have one of
logo.
those on my desk. It's still in the office.
And on the back, it talks about the 100% college tuition. I think your odds will be, it doesn't work at the casinos, but I think your odds of winning and getting 100% college tuition are much better. So again, I thank you all for the questions and the format. We have a great partnership with the World Affairs Council, and I couldn't say enough about everything that you do as well. The virtual Model UN, I noticed yesterday, I got the Twitter feed, that's just great. And I know we talked about that earlier. So everything that you do for the youth of America and Connecticut, I can't say enough about. So thank you.
Oh, thank you. We still have a few more minutes though,
Okay.
and I have a few more questions for you, but I'll let you get another plug in because we're so proud of you, and we want, we want the Connecticut National Guard to have the best and the brightest. So, do you think that there are ways that this experience, as we have this, global health crisis that's unprecedented around the world, do you think that this is going to, in any ways, impact or change our approach to national security in the future?
I think it definitely will. One of the things that we look at pretty much every day now is how this will impact our readiness. So we're doing things that we thought we would never do, 8 weeks ago. And what I'm talking about is even simple things like telecommuting. Quite honestly, our systems, federal systems, didn't have access to Microsoft Teams or Skype, or we still don't have Zoom for some obvious reasons. But we have not used those platforms. And I think that'll be a way of life as we go forward. I think from a readiness standpoint, I hope that people will remember this. Unfortunately, as Americans, we have short-term memory sometimes. So situations like 9/11, we walk away from them and we don't learn from lessons in the past. So I hope that we'll apply this across the board at the larger national security issue. And I think we need to pay attention to some programs. We talk about whole of government approach. And I think this situation may have identified that the military is doing great effort, but there are some other departments within the Department of State, for instance, that need some probably attention and funding that can help us get after this and maybe be more proactive in our approach.
So, immediately looking forward, what are some of the biggest challenges that you're facing?
So I think we're trying to figure out what happens when we turn this all off, whether that's 6 months from now, 12 months from now, and how we get back to what's normal, or this may be the new norm. We talked yesterday at length about, going to a restaurant. You may have your temperature taken. Your waiter or waitress may be wearing a mask. We may, at some point, like I said, virtual drills. So the first time ever, we actually had virtual drill weekends, and how trying to gain the success of that, measure the metrics behind that. It doesn't work for every unit. Some units need to get to the field. They need to do land navigation. They need to do weapons training. But those are some of the things that, 12 months or 6 or 8 weeks ago, we may have had on the very long-term radar, but that's right in our headlights right now.
So someone from the audience, in the audience has a question. What is how is the morale of the Connecticut National Guard, and what can the public do to help support?
So quite honestly, the morale is great. So if you were a student, you're not going to school and we're paying your tuition. So our students volunteered. They were some of the first soldiers and airmen that came in to help us with the whole multiple bunch of different mission sets. Employers also, many are laid off. So they have a couple motivations. One, they want to serve the great state of Connecticut, but two, we're also coming in to get paid. Initially, they came on what we call state active duty. We were able to transition them to federal orders. So today, as we speak, I think we'll hit about 800 on orders applied towards this COVID response.
Perfect. And so one more time, I'm going to give you a chance to plug. How can someone join the Connecticut National Guard?
So there's two websites here I'd like to give you. First is www.nationalguard.com/CT. That's for the Army Guard. www.gang.com/CT for the Air Guard. And we'd love to have you raise your right hand. We can actually get Megan and Amanda right now because I got the flags behind me. Raise your right hand. Repeat after me. It's that easy.
Well, thank you so much again for all that you're doing. We are so proud of your work. We're so proud of the men and women that serve the state of Connecticut and in this great country. So keep up the good work, and I just hope everyone stays safe and well.
Thanks again for the format and for everything you're doing. I really appreciate it.